Okay, so we are going to draw the brachial plexus using my daughter's sketch pad here. It actually goes pretty quickly. Just have to go through the motions. So we start out with the roots, right? C5 to T1. Now, just have to memorize this. Two of them come together. One kind of stays, well, alone. And, well, those are your roots there. They both come together and form the trunk. This one just continues on. So trying to color code things, this seems pretty straightforward right now, fairly symmetric. Two come together, two come together. The C7's kind of lonely. Now, that is roots and that is trunks. Now, continuing with our color coding, we're going to go with divisions here. Now, going to do anterior and posterior divisions in two different colors here, so just bear with me. Each one of these trunks have a posterior division, so we're going to do this in a dotted line because it's going posterior, and that is going to eventually form a chord. So let's see, we're going to do divisions in pink and then chords in orange. These trunks also have an anterior division here, so this continues on here, this one continues on here, and now the C7, remember, it was lonely. It kind of wanted to join one of these two, but it didn't have a chance up here, actually at the root level, excuse me. So it's got to pick one or the other, and this is where you just have to, well, memorize some things. It goes up. It chooses the upper one, and C7 joins here. So that is our anterior and posterior division, anterior, posterior division. So this forms the posterior chord. This is the medial chord, and this is the lateral chord. So we're doing pretty well and still fairly symmetric, pretty easy to follow along, I hope. And now, as we continue on, we finally have the last one here. Randy Travis drinks cold beer or red trucks drive cats nuts, depending on which mnemonic you use. Here we are going to have more divisions. So this is where things can get a little bit tricky to draw, but this will continue on here, this will continue on here, and then we form, well, the famous, so to speak, M in anatomy. If you can find that structure right there in the brachial plexus, and it's pretty fascinating when you find it because the axillary artery is right underneath it, and it really does look like a letter M from the side. Now you've found your main final branches. I'm going to keep this in orange just because it's easier, because it's posterior. We're going to keep dotting it. They also have a branch. See, these have two branches, two branches. This is also going to have two branches, and we're just going to draw them right there and right there. And our final nerves are M for musculocutaneous, A for axillary, R for radial, M for median, and U for ulnar. There's our marmu, or our most alcoholics must really urinate. If you draw the R coming down here, if you split it evenly to try to keep things symmetric, which you can do if it looks better to you, you can just draw it like that. Then you have the alcoholics mnemonic. Don't like that term. I rather use the marmu, and I tend to keep it here because that's just how I learned it. So that's the basics. Now there are extra branches, and this is where things can get a little complex. So if you want, you can just pause here, redraw it yourself. I encourage you to do that, and then come back when you're ready for the final branches. All right, welcome back. Here we go. So we're going to have a couple different branches here. So at the root level, we have the dorsal scapular right there. At the trunk level, we have the suprascapular, and depending on which textbook you learned it from, some people say it comes off of the roots from C5 and C6. Some people say it comes off the trunk level, but that's the nerve to the subclavius, tiny little muscle. So dorsal, scapular, subclavius, suprascapular. So 1, 2, 3. Another 1, 2, 3, and this is maybe a little bit hard to draw. I almost want to draw an orange because it kind of goes posterior, but we're going to keep the same blue here. This comes down, down, and down, has a branch from C6 that joins it, and has a branch from C7 and joins it. This is the long thoracic nerve that goes to your scapula. So C5, 6, 7 is that one. So 1, 2, 3, 1, 2, 3. Hopefully that kind of makes sense and we're keeping on track. Divisions do not have any branches, so that's easy. Chords do. So we have the 3s here, and I'll just start drawing them out just to have them in place. 1, 2, 3, 1, 2, 3. So remember, 1, 2, 3, 1, 2, 3, 3s and 3s, and this is the one that's kind of hanging out. That's the lateral pectoral. So if there's a lateral pectoral coming off the lateral cord, yes, we're going to have a medial pectoral coming off the medial cord. The others are just a little hard to remember. You just kind of have to get used to it. This is the upper subscapular, and if we have an upper, we have a lower subscapular. Some people say this is superior subscapular, and this is inferior subscapular. What's in between is the thoracodorsal. That goes to your latissimus. Medial pectoral, then we have some sensory branches. Medial brachial cutaneous and medial antebrachial cutaneous. These are sensory nerves. That's the upper arm. That's the forearm. Easy one with this one, 2, 3, 4 letters. Hopefully that'll help. So there is some patterning that goes on that might help you. The color coding really helped me, but that is the entire brachial plexus.